This is an AQA psychology revision video for the GCSE paper 2 topic of psychological problems. This revision video will focus specifically on the Wiles key study, which is about cognitive behavioural therapy. So this is a key study, which means you could be given a 9-mark question on describing and evaluating Wiles' study. So on the screen right now are some prompts and some reminders of how you should structure the description part of describing a study in psychology. A really effective way to revise key studies is through the image on the screen. So we will return to this at the end of the video once I have explained the key study. But if you look, I have jotted down some key numbers and some key terms to do with the study, along with key terms that I've highlighted in orange to represent the relevance of them to AO3. So if you are using this video purely for revision purposes, now would be an excellent time to pause the video and see if you can think about the relevance of each of the numbers and the key terms, and then you can skip to the end of the video or skip to the chapter in which I review this study to see if you are correct. If, however, you are watching this video to make some notes and to better understand the Wiles key study, then please keep watching. The aim of Wiles' study was to investigate whether antidepressants alone or antidepressants when combined with CBT, cognitive behavioural therapy, was a better treatment for depression. So Wiles and previous researchers had noted that antidepressants only work for 30% of patients with depression. So that means that there are 70% of patients with depression that are prescribed antidepressant medication and are what are called treatment resistant, in that treatment of a drug does not successfully help to reduce their depressive symptoms. So this study was to investigate what alternatives are out there. Can antidepressants be combined with other treatments to help improve someone's life who suffers with depression? So the participants were 469 participants from Bristol, Exeter and Glasgow, so various different locations across the UK. And they came from 73 different doctors, different GP practices. All of the participants were treatment resistant. So they had been taking antidepressants for 6 weeks, but still showed signs of clinical depression. So they were treatment resistant because the antidepressants by the 6th week was still not working for them. The method consisted of randomly assigning or randomly allocating participants to 2 conditions. They were antidepressants on their own or antidepressants combined with CBT. Throughout the study, they were assessed for their symptoms and whether their symptoms had improved using the Beck Depression Inventory, which is a questionnaire that gives a score on an individual's level of depression. They complete it themselves. The higher the score on the Beck Depression Inventory, the higher level of depression or the more severe their depression is. So Wiles wanted to make a comparison between the groups as to whether drugs alone, antidepressants alone, or whether antidepressants combined with CBT was a more effective treatment. The findings of the study were 21.6% of participants in the antidepressants only condition had more than 50% of a reduction in their symptoms. So that was measured through the questionnaire. So at the start of the study, what their depression was compared to the end of the study after they'd been taking the antidepressants. 21.6 of them had more than 50% of a reduction in their symptoms, compared to the participants who received CBT alongside the antidepressants. In that case, 46.1% of them had more than 50% of a reduction in their symptoms. Furthermore, after 12 months, those who were in the antidepressant and CBT group continued to show greater levels of recovery, and their symptoms did not return over that 12-month period. From the Wiles study, we can therefore conclude that CBT and antidepressant medication taken together is more effective than antidepressants on their own. And furthermore, given that the group who received CBT alongside taking antidepressants did not have any symptoms return over the 12-month period, it suggests CBT is a more suitable long-term treatment compared to antidepressants. So that is the description of the Wiles study. When we think about these key elements of Wiles study and how we can evaluate them, there are three questions for you to consider. So this is an opportunity for you to pause the video to try and explain and give as much detail as possible for the evaluation points on the screen, and I will go through the answers in 5 seconds. Okay, so thinking about how to evaluate the Wiles study then, the participants were randomly allocated, and this is good because it limits the chance of participant variables, because if they weren't randomly allocated, there's more risk of bias, and the bias here could be that all of the participants who end up taking just antidepressants on their own could be the really severe depressed participants, which would then make it seem like the antidepressants aren't as effective when they're not combined with CBT. And that's what it would seem, but that would be due to the participant variables and the fact that only the severely depressed people remained just on the drugs. Furthermore, the self-report method, the Beck Depression Inventory, was used to identify the level of depression at the start and the end of the study. And so the difficulty here is when you have to reflect on your own behaviour, sometimes you're not truthful because you want to make yourself seem better. So participants might have wanted to make themselves seem as though they weren't suffering from as bad depression as before, especially if they were the participants that had CBT, because part of CBT is about challenging your irrational beliefs about yourself, etc. And so they might have not answered truthfully on purpose to make themselves seem better, or because they are depressed, they may have actually overestimated how sad they were feeling. So that limits the validity of the findings. Now, you only need 2 evaluation points for key studies in psychology. So those are 2 really good key evaluation points to use. But finally, this key study can also overlap as evaluation for CBT, because you have to be able to evaluate CBT in the psychological problems unit as well. And so this final evaluation point can be suited to that. And that is that it's a well-controlled study which shows the success of CBT, or a holistic treatment for depression, which is CBT combined with antidepressants. So because antidepressants fail so many people with depression, this study really shows the usefulness of therapy and antidepressants together. So you can use this Wiles study as supporting evidence for just how effective CBT is, especially when used alongside antidepressants. So to review, if we have a look at my suggested revision method, what we have here are a number of different key terms, facts and figures about the Wiles study. And so if you have skipped to this part for revision, let's have a look at whether your thoughts were correct. So we start with the figure of 30%. That is to represent that only 30% of people on antidepressants alone are successful in terms of their reduction of depression symptoms. The other 70% are what are known as treatment resistant, and so Wiles wanted to uncover whether antidepressants combined with CBT would be a more effective treatment for those individuals who are treatment resistant. So the study consisted of 469 participants from 73 different GP practices, and they had all been taking antidepressants for 6 weeks but were remaining as treatment resistant during those 6 weeks. The method consisted of randomly assigning participants to either antidepressants alone or antidepressants with CBT. They completed a questionnaire known as the Beck Depression Inventory at the beginning and the end of the study, where they assessed their depression symptoms, and that is used to indicate how depressed a person feels. The findings were that in the antidepressants alone condition, 21.6% of participants had more than a 50% reduction in their symptoms, compared to those that received antidepressants with CBT. 46.1% of those had more than a 50% reduction in their symptoms, and furthermore, that reduction in symptoms lasted at least 12 months. The symptoms did not return within a year. So that demonstrates the effectiveness of CBT, and it demonstrates how, when combining antidepressants with CBT, those two treatments together can be very effective. So when we're thinking about the things highlighted in orange and how we're going to use those for evaluation, we've got the fact that they were randomly assigned to antidepressants or CBT, and we use that as a strength, and the sort of thoroughness of the design and how it eliminates 4 potential participant variables so we can be sure of our results, which are here. We've also got a weakness that it's the use of a questionnaire, and that we are getting people to assess how depressed they are based on their own reflection of themselves, and that can limit the validity because of things like social desirability bias, where people might lie to make themselves feel better, but also due to the fact they are people with depression, so they might just make themselves or think that they are feeling a lot sadder than they are. And finally, we've got the strength that this study shows just how effective CBT is when combined with antidepressants and CBT. So this can be a really effective revision technique, because you can constantly test yourself on these numbers, these facts and figures, and you can also think about how things link, just like I've done with the arrows pointing to how all of these key terms are relevant, and making sure that you identify the key terms, if you like, the crucial key terms for each key study. So that concludes the end of this video. Thank you for watching. I hope you found it useful.